Hello and welcome to Nursing 130 Perioperative Nursing. I'm Professor Brooks, and I want you to know that I've been where you are now. I started out in community college, got my ADN from a rigorous and fast paced program just like this one. Then I got my BSN and master's from Regis University in Denver, and I just recently finished my coursework for my doctorate of education at Aspen University in Denver. I've worked in psych, med surg, and the OR. My specialty is perioperative nursing, and I'm really excited to be able to share with you some of the cool stuff that I know about that environment. I've worked in all manners of surgery: total joint replacements, brain surgery, neurosurgery, vascular, spines, appies, choles, eyeballs, etc. So I've got a broad base. I've also had a number of surgeries myself, I think about 18 as of this recording, and with a couple more coming up. So I've got a lot of experience from both sides. I'm a certified Med-Surg RN and a member of the Academy of Medical Surgical Nurses. I'm also a member of AORN, the Association of Perioperative Registered Nurses, and AAMN, the Association of Men in Nursing. I go to one of those organizations' national conventions each year, so I'll be peppering our discussions with new info and experiences that I learned from those. And you'll also find some info from the latest conference on Canvas, as well as some invitations to some of the local meetings for those organizations. I've been teaching here at Grossmont since 2012 and 2 years somewhere else before that. I also work for Hearst Review as an NCLEX expert. This is a 3-day NCLEX review course that I travel around the country and teach on my school breaks. This is to help people prepare to pass the NCLEX. NCLEX is a clinical reasoning exam. Those are synonyms. NCLEX equals clinical reasoning. And that's what you're going to start learning and practicing here. I teach because I am a good nurse, and I've known a lot of good nurses, but I've also known some bad nurses. And I want to impart my knowledge to others who want to be good nurses. By disseminating the information and techniques that I have to others, they will be able to positively impact a much greater number of patients than I could on my own. And I get a lot of satisfaction in watching the growth of my students over the short time that I have them. I've educated well over 600 nurses now, and they are impacting tens of thousands of patients out there, and that's exciting. So are you just hoping to pass this class? The objective is not just to pass this class. The stuff is important. Think NCLEX. Think safe and competent practice. Remember that you're not studying to pass the exam. You're studying for the day when you are the only thing between the patient and the grave. Think about an interview. If they ask you a question about a drug, a treatment, a priority, and they will. This stuff is important. They don't want to just see that you have a nice smile and you can pat someone's hand. They have therapy dogs for that. Someone may want to see a care plan that you've done, either in a job interview or an interview to get into a bachelor's program or grad school. Papers too, pamphlets, posters, everything you do in here counts out there. Students sometimes complain about the extra stuff that they have to do. It's not extra, it is the stuff. This is nursing. We research, we use evidence-based practice, we teach, we explain things, often with visual aids that we make. So you're going to get practice in those areas. I want to educate nurses who are safe, competent, confident, who understand the content and concepts, and who know the whys, W-H-Y, behind what we do. A big goal I have for you is to understand the whys. What is going on in the patient that is making XYZ happen? Why do we treat it with diuretics? Why is hydration going to be so important for immobile clients? Why? You need to be able to understand the why and apply what you know to the situation and figure out what to do about it. Because guess what? Patients don't give you multiple choices. It's not like they're going to look at you and say, I'm 4 hours post-op. My stomach is upset. I think I'm going to vomit. Do you want to A, take my vitals, B, get me an antiemetic, C, call my doctor, or D, take me for a walk? It's not how it works. Patients don't give you multiple choices, right? They give you information, they give you data, their vitals, their symptoms, and you have to figure out what to do about it. So we're going to be doing a lot of practice with that this term. If you feel you've been spoon-fed up to this point, you're going to get weaned immediately. I do not spoon feed. I do not hold hands. If you've been given study guides in the past where you were told exactly what to know for the exam, no. That's in the syllabus. They're called SLOs in the course objectives, and you're responsible for them. Each day of class has SLOs, and I recommend you review them so you know what you were supposed to get out of each unit. There is a class prep study guide also that I recommend you work on prior to class, in class, and after class. That's the first item listed under resources on Canvas. But I'm not collecting them because who is that for? It's for you. I recommend you trade them with someone and learn from each other's thoughts and observations. So I don't want to see them except when you come to me with questions about the class or something you didn't understand. I'm going to want to see what you've researched and figured out on your own. I'm going to ask you what you've been doing to learn the material to prepare for class. If you fail an exam and come to meet with me or the SSAs, we're going to want to see them or your notes. We want to know what you've been doing outside of class, which is where a lot of your learning is going to occur. We only have 14 days together, and 3 of those days are test days. So do you really think that I can teach you all you need to know about the perioperative environment in 11 3-hour classes? Absolutely not. So use the resources that I've provided for you that I recommend, but I'm not going to look over your shoulder and make sure you're doing so. Are you adults? Are you going to take responsibility for your own learning? If you haven't started that yet, you'd better do so now or you're not going to make it in this program. Active learning, taking responsibility for your own learning experience. Don't come to me with an empty bucket and expect me to fill it up. You have to get it at least half full first. There's a ton of info in the book. Some chapters are not going to be prescribed, like the anatomy and physiology, the normal functioning of the system. You can read this on your own if you need more information. And there are some self-learning modules that are recommended in the reading list. You will get out of it what you put into it. There's a big movement in education called flipping the classroom, which means less lecturing and more learning by doing. Case studies, student presentations, self-study, group study. Some people like it, some people don't, but it is preparing you for further degrees because most of them are going to be done on your own. Most BSN and master's programs are completely online and independent, so you need to start practicing that type of learning. So if I don't get to every slide in a PowerPoint, or every PowerPoint for that matter, you can read it on your own. The things we talk about and do in class are going to be just as important as what's in the PowerPoint or the book. I don't need to waste class time reading it to you. Conversely, there are things in the reading that I will never mention in class or in the podcast or in the recordings. I couldn't possibly in the time that we have. Are you still responsible for it? Yes, that is testable information. And you may read some things that are not on the test. Well, darn, you learned something. Is any learning wasted? No. Just know that everything you learn and hear, whether you're tested on it or not during this class, you're still responsible for it. And that means it could come up on any future test and any future class, including the NCLEX. So in front of the class, I'm like the beacon of information, the blinking light, and you don't want to be the deer caught in the headlights. So you need to come to class being prepared. So work on those class prep sheets to get ready for class, listen to the recordings. After the first exam, the class is going to switch to a flipped classroom where the lectures will be available to you online on a podcast. And you'll need to listen to those before you come to class, or you will not have any idea what's going on. And fortunately, they are available to you throughout the course, so you can go back and re-listen to them, especially before an exam. So after doing your preparation for a class, some people like to use the KWL method, which is write down what you know, what you want to know, and then after class, what you learned. If there are still some blank spaces in that, talk it through with your study group or come see me. It's going to take sanguineous, echinus, and lacrimal secretions to get through this class. Wait, those words weren't in the reading. How do we know what they are? Did you have AMP? Then we're good. I'm going to be building on all that you've already learned in micro, AMP, 120, farm. So brush up. It's hard. There is attrition, not just in this class, but in the program. A recent graduating class started with 36 and they graduated 23. When I was in school, my class started with 45 and graduated 25. So don't get hung up on who went out or why. It is truly none of your business and it will only serve as a distraction. Just worry about yourself. Follow directions, do things right, do things safely, and most of all, think. If someone is going to be successful in our program, they need to learn early on what works and what does not work for them, and spend their time doing what works for them. The classes move too fast to do it any other way. All of these skills, whether they're learned in orientation or along the way, must be continued to be practiced throughout the program for your best chance at success. This is also where your job interview begins. Many of you will ask me or your clinical professors for letters of reference later. Our impressions of you now The professionalism you project will be all that we have to go on. Also in clinical, you are being watched as potential employees. Always think about the impression that you're making, not just on the manager, but on the coworkers, because they have a say in these things too. It is a working job interview. You're going to want to work at one of the facilities you go to for clinical. Here's a quote from a student's final eval. Being a nurse is akin to always being a student. And I'm not studying for a test where I can get my licensure and forget what I learned in school. Rather, I'm studying for a career. You never stop learning, and you never stop using what you've learned here. A couple things about professionalism. There is no right way to do the wrong thing. Don't be sneaky. It's not ethical. It's not professional. And that's a big part of this program because that's a big part of nursing. Every year, nurses are named one of the most ethical and respected professions. Cheating comes in many forms, not just on tests. You could copy each other's homework. You could trade with your other cohort half. But whomever you get it from, are they going to hop in your seat and do those problems for you on the exams, on the NCLEX? Because that's what the homework is preparing you for. Those kinds of things will be test questions, and you need to know how to do them. Are we clear on that? You're only hurting yourself if you do not take the time to learn how to do things the right way. Also, be respectful. Don't talk while I am or another student are speaking. No negative comments should be heard about your colleagues, nurses on the floor, other professors, administrators, or staff, and you'd better not be dumb enough to do so on social media, because all it takes is a screenshot, and that can haunt you forever. Study groups. I'm a big believer in study groups, and this does not mean getting together at Starbucks and silently reading your notes in the same room. Teach each other. Use the class outcomes for this. Do not try to write them out before class. That is a waste of time. Students who use these well go over them with their study group. So put each other on the spot. Okay. SLO number 4 for class 6. It says here, you'll know 5 causes of cardiogenic shock. Go. If you can't list them without a doubt and without hesitation, then guess what? You don't know them. So studying this way will tell you what you know and what you don't know. You'll also have tons of other resources. NCLEX books, programs, and apps. NCLEX Mastery is a phone app that a lot of people like. UWorld is very expensive, but students have told me that it is most likely NCLEX and very helpful. PrepU is part of the e-learning platform that you have available for you at no extra cost. You can do quizzes on there to check your knowledge. However, they recommend that you do more shorter quizzes, so 5-question quizzes. That'll build up your mastery level faster and get you into the harder questions faster. But I will tell you there are a lot better programs out there. So if you're going to invest in something, and that's how you should think of it, it's an investment. You're going to be using it for the next year and a half or more until you pass the NCLEX. It's an investment. So I'm not going to recommend any particular book or app. They're all good, but it's been proven that the more questions you answer, the more prepared you will be for my exams, everyone else's exams, and the NCLEX. Now, a lot of times I get questions about questions. I cannot accurately answer a question about a question unless I see the question, okay? So sometimes people will come to me and say, there was this question about XYZ, and I thought it should be A, but it was B, and I don't understand why. Well, neither do I, based on what you just said. So there's usually some kind of subtle nuance that is missed when you tell me about it. So if you want to ask me or any future teacher about a question you find somewhere, send us the question. Do a screenshot or copy and paste, and then you'll likely get a more complete and accurate answer. Quick word on portfolios. There's just 2 things you'll need to do for it for this semester, and then trade with a friend for comments and turn it in at the end of the second 8 weeks. Preferably all in one file, all online. It will be a larger part of your second year experience, but I want you to start thinking about things now that you want to put into it. Award certificates, volunteer certificates, exemplary work, 1 good paper, 1 great evaluation. It's not a file cabinet, it is a showcase of your best work. So save things somewhere that you think you'd want to show to a potential employer as representative of your best work, because that's the point of a portfolio. Okay, this class moves really fast, and you need to move fast to keep up with it. Once you cross that threshold, you're on the clock. This is my time. This is your job now. This is where the professional conduct starts. So be on time and be ready for work. There are yellow sheets for tardies in the back of our classrooms. 3 tardies equals 1 absence. You can only have 2 absences to pass the class. And for bad conduct, you can get a warning, and then you can be removed for 2 days. So suit up, show up, and keep up. Some admin stuff. If you have to update your contact info, do so in WebAdvisor, but also let me or your current professors know, because we all just get a list at the beginning of the semester and we're not continually checking WebAdvisor for updates. So if something changes, let us know directly. Assignments. This is the last thing. Let's talk about assignments. So everything you turn in online needs to use the proper naming protocol. If it doesn't, it will be returned to you, which may result in you getting it turned back in late. This goes for the whole program, for everything that you email us, and we all know that you've already been told that, so please just do it. I'll pass a sign-up sheet about the assignments in class. So first thing we have is an EBP article. A well-informed nurse is a better nurse, and the same goes for students. Each of you will sign up for a topic and find a current evidence-based article on that topic from within the last 5 years. Read it, summarize it, and present it to the class in about 5 minutes. You are not reading a 6-page article to us. As part of the presentation, you're going to come up with a PICO question, and if you need more help with that, there's a tutorial within the assignment on Canvas. Build a brief PowerPoint for this, which can help the more visual students process what you're saying. Just some highlights about the article and what they found. Case studies. The full info is on Canvas, but these should be fun and interactive and limited to about 10 minutes. You will essentially be teaching the class on your topic. When I pass the sign-up sheets, you'll see in red that I want only 2 to 3 per day. I will ask you to change if there's more. So if you see that there's already 2 or 3, don't sign up for any more on that day. Last is the major assignment, and this is a group project, groups of 3. Lots of info and examples are on Canvas, but it consists of a paper, a live class presentation, and a visual component, a magazine cover artistically representing your theme. So for the paper, this is an APA paper. APA is scholarly writing. Conclude each thought, section, and paragraph with a transition to the next one. Figure out when to use a dash and when to use a hyphen. Solve the mystery of the apostrophe, people. Have a labeled conclusion. See web links for APA help. APA is professional scholarly writing, like what you would see in an academic journal. So as you're reading these journals, doing your research, try to write that way, the way that they're written. There's lots of rules that go with APA, and you need to learn it because that's how all of your papers will be done here throughout the rest of the program and in any advanced degree program you go into. I've had to write a 2,500 word APA paper every week for the last 3 years, so I'm pretty good at it. I'll give you lots of constructive criticism if you don't take the initiative and find out how you're supposed to write professionally. PowerPoints, pay attention to my PowerPoints. They're not perfect, but they don't have a ton of text. They have pics. They try to be somewhat interesting, entertaining. The font is readable. There should be more content than white space. I'm visually impaired. I will take points off if I can't see it from where I'm sitting. I generally don't use font any smaller than 22 on the PowerPoints, preferably 24. All right, so we'll have a lot more to discuss in our first class, but this gives you a little taste of what to expect. You're all responsible for all the content in this video, so make sure your friends have watched it and maybe even watch it again. Thanks for watching, and I'll see you soon.